when we're doing liposuction, typically we take fat out from areas that we don't wish to see. But instead of throwing away that fat, we are now doing things to the fat such that we can re-inject that fat in an area where we like to see more fullness. The buttock area is typically where women and sometimes even men want to augment that area. And fat is considered to be the most natural augmenter in the buttock area. In this country, it has not been a procedure that has become very popular until in the last 3 to 5 years. The reason why this has become important is because there is more focus on the buttock as compared to on the breast. Partly because of our lifestyle, partly because of so many celebrities talking about it, and the procedure has now become one of the ones which has got the highest spike in more and more women and sometimes men asking for buttock augmentation. So typically the area, what we call as a love handle, or as my patients call the muffin top, the stuff that pours out when you wear a pair of jeans. Well, we don't want fat over there, but we want fat in the area where you would, in the buttock area. So typically making the waist narrow and the buttock more wider or more rounder creates a very good aesthetic appearance. And you can also look from a different perspective. If you're doing a tummy tuck and you're going to look fantastic from the front, but not from behind, that doesn't make sense. Every potter who makes a pot makes the pot look fantastic from the front and from behind. I believe in the same way, if I'm an artist taking care of how to take care of your body and the way it looks, I like to create somebody who looks perfect from the front and from behind too. We've been doing this since 2008, 2009, and so we've done over 200, 250 cases. And we inject the fat within the muscle, within your buttock. Muscle has got good blood supply. And when you inject the fat in small quantities in different directions at different depths, each thread of fat that you put inside there tends to get a good blood supply. It survives, and the results last for a very, very long time. I don't remember a single patient since 2008, 2009 who has called me saying, I've lost my fat. It's important to choose the right person who has done this many times to get the results you're looking for. This surgery typically performed at a surgery center. If you're just doing liposuction and fat augmentation, it takes around 2 hours or so. That's it. Outpatient surgery, come have it done, and you can go home the same day, around 5 to 7 days of downtime. Yes, you'll always be put into anesthesia for doing the procedure, but it's a short time for just doing liposuction fat augmentation, 2 hours. If you're doing with a tummy tuck, it takes 4 hours, so it's not something that takes typically a very long time to do it. The incisions for a liposuction and a fat augmentation of the buttock typically is just the size of a fingernail. No one would know about it except you. The fat is augmented or injected through a small needle around 3 millimeters. That's 1/8 of an inch, and that's where the fat is injected from. So no one knows, one stitch, it's all healed up. I tell my patients that what I'm doing right now is setting the proportions right. Now it's up to you. I always explain to them from perspective of a car. You've now purchased a new car, but if you don't maintain it, then you're going to run in trouble. So what does maintenance involve when you're doing all this? A healthy diet and a passion for exercise. Maintain the same body weight. Easily said, then done. But I emphasize a lot before the surgery. And if your BMI, which is a body mass index, is very high, I will say I want you to come back within normal range, definitely less than 30, because I want to create a result that lasts forever. And if I have a person who doesn't understand that I have to have a healthy diet and exercise after the surgery, then I'm not doing the right thing and I will not do it. Our objective always at Genesis Plastic Surgery and Medical Spa is to create a natural look that is aesthetically correct, nothing that is out of proportion. And I think that's where lies the artistry. How much fat to inject on each product, where is the fat going to come from, where we inject, to create a result that you can look and say, wow, this is an amazing change. I would like my patients to say the word wow when I'm finished with the surgery. That tells me I've achieved my goal in what they've asked them to do.